So, welcome everybody to this webinar, Integrating Support for ECD and Nurturing Care in Primary Health Care, Experiences from Italy. My name is Dorica Trikic and I'm going to be your host today, and I'm a Senior Program Manager in ISA, and I have to confess, a great supporter and very passionate about this initiative, health systems for ECD. Today's webinar is organized in partnership with the Centro per la Salute del Bambino, NGO focusing on health of young children, an NGO that played the leading role in introducing ECD health policy and practices in Italy. But before we start, I just want to give you a few very simple information and instructions. For interpretation, can I have a next slide, please, Jen? For the interpretation, most of you are already familiar, but let's do it again. You go to this little globe on the stripe below, and you pick one of three. You pick English, Serbian, or Russian. We don't have French and Italian. This is not correct. So you're going to pick one of the languages. And also we invite you to post your comments, questions in the Q&A box. So we will have colleagues observing what's going on there. And at the end of the webinar, we are going to try to address some of your questions. But use Q&A box, not the chat. And as some colleagues already asked, yes, after the webinar, you will have access to all recordings in 3 languages, and you will have access to materials and PowerPoint presentations. And you can feel to write your comments and questions in the Q&A box during the presentations and during the whole webinar, and we will try to come back to them. And now I'm very happy and very pleased to invite Evelina Borisova, Regional Early Childhood Development Advisor in UNICEF ECARO, and my Executive Director, Liana Gent, and to officially open this webinar and welcome you all. So Evelina, let's start from you.
Thanks a lot, Zarisa. I hope you can still hear me okay. Welcome everyone, a warm, very happy welcome to you for today's webinar. And as you heard, it's organized as a part of the Initiative for Health for Early Childhood Development. We, as always, are very happy to see so many practitioners, but also I see policymakers among us, which is really at the heart of this initiative, is bringing together both practitioners, policymakers, and academics in the area to really further the work that we are all very passionate about. I just want to remind us where we started. Last year, UNICEF Regional Office for Europe and Central Asia, together with WHO Europe and our wonderful partners, International Step-by-Step Association, with support of a very dedicated and amazing technical advisory group of really renowned experts for health systems and early childhood development, launched this exciting initiative, of which we're continuing to be a part today. And the premise of this initiative is quite simple. It's really recognized that every touch point of routine healthcare provision, whether that be through home visits or through health facilities, or any other way that the health system comes in contact with families and young children, is truly a unique and extraordinary opportunity to strengthen the competencies of caregivers and of parents on providing the best care for their children, the nurturing environment, to monitor their child's development, and to detect as early as possible factors that may affect their trajectory, their optimal trajectory. We see this as an amazing effort and an amazing opportunity to really leverage the momentum and the opportunities we have through the health systems. And we know that we're here together because we all believe in this vision. We started this initiative by launching it last year, but also really continuing to think together about how this initiative can create a platform for advocacy, for learning, for exchange, to support practitioners, experts, and policymakers in all of their efforts, in all of our efforts to build health systems that holistically address the needs of young children and their families. And today's webinar is part of the learning series and events that are planned for 2023. And you will see there's quite a bit more on the agenda coming up your way, aiming to present experiences and resources to support practitioners and policymakers. And we really, really hope that these events will serve as an inspiration and continued guidance and support for many of you who are with us today. And from my side, welcome again. We look forward to the session. And Liana, over to you.
Thank you, Zorica. Thank you, Evelina. Also from my side, a very warm welcome to all of you. It's such a pleasure to see so many countries represented. And as Evelina said, also practitioners, policymakers, but also many of our supporters and partners from different foundations and agencies. For us at ESA, it is truly a privilege to be part of this initiative and to be here with all of you today. And we are particularly proud to partner with UNICEF and WHO, and for today to have a webinar that showcases the work of one of our members, the Center for Child Health in Italy. As Evelina mentioned, today's webinar is part of a larger initiative, and the core theme for this initiative, Health Systems for ECD, is actually at the heart of today's webinar, which is to look at how partners in Italy and stakeholders in Italy have integrated early childhood development and nurturing care in primary health care. Again, a reminder, as Evelina said, through our initiative, we aim to disseminate evidence-based and best practices on programs and policies that can inspire policymakers, service planners, and providers to integrate ECD into health. Part of the initiative, we have developed a website, and that has launched in December, and it is such a pleasure for us to see that in such a short time, the website has had a great number of visits. So it's clearly meeting its aim to be a source of knowledge, but also a one-stop shop for Europe and Central Asia and beyond to curate contemporary evidence-based guidance and resources on developmentally oriented health systems, but also to provide a safe space for professionals to learn and exchange. So through the initiative, we aim not just to have a static repository on the knowledge hub in the website, but also to create a learning community, which we hope today's webinar will achieve. Now, we all agree that health systems are very well positioned to promote early childhood development and learning because of their multiple interactions and the relationships that they build with families. This way, they have the potential to reach out to all children, including those that are marginalized or excluded, and to offer support for healthy development during the first years of life. For health systems to achieve that, and for services to achieve that, they must go beyond the traditional focus on physical health. They must move to supporting holistic child development and empowering parents and families to provide children with the best start in life. This is at the core of our mission at ESA and also our partners at UNICEF and WHO. Again, today's webinar will look at experiences in Italy, and we will learn about the work done in that country, but also the opportunities and challenges that professionals face when working towards integrating ECD and nurturing care in the primary health services. We are very proud to hear from, again, the Center for Child Health. They have been amazing in their work in their country, in Italy, but also an inspiration for many countries in Europe. They have shared often in the ISA events, and we are very excited to learn from them today. So wishing all of us an inspiring event, and back to you, Zorica.
When I want to play by rules and mute myself, then I forget to unmute myself. I would really like to express a huge thank you to Evelina and Liana for all their support and inspiring leadership to our team, because we have a team working on this initiative. And thank you for always finding time to join and open the webinars and welcome guests. So Jen, you can close the slide. What I would like to make a comment for those who joined lately: pick your language by going to this little globe on the bottom of the page and pick between Russian, Serbian, and English, and also all your comments and even greetings you can share in question and answer box, because that's the place where it's going to be visible for everybody. So today, as my colleagues Liana and Evelina already heralded in a way, today we are going to learn about opportunities and challenges that were faced by colleagues in Italy who decided to step a little bit out of the comfort zone and to think a little bit out of the box what primary health care is about. And we are going to do it through two really, in my opinion, outstanding initiatives. One is, and Giorgio, I was exercising my Italian, un villaggio per crescere, a village to grow, and nati per leggere, born to read. And we will going to start with us. We have distinguished colleagues. We have Dr. Giorgio Tamburlini, we have Miss Andruena Alushai, I think it's okay, and Dr. Laura Reali, and welcome to all three of you, and thank you for allocating your time to broaden our horizons and inspire us, and share, of course, share your experience. So Giorgio, I would like to start with you, and your presentation, which will give us an overview of the whole process, how you did it, but also what were the obstacles and challenges that you had to face while doing that. And for our participants, Giorgio Tamburlini is director of the Centro per la Salute del Bambino. He is developmental pediatrician and one of the pioneers in transforming primary health services to support young children and families. Giorgio is also a very valuable member of technical advisory group of initiative, and we like to say one of the godfathers of the name of our initiative. And we are really, really happy to hear your story, Giorgio. So back to you. The floor is yours. You are going to share your slides.
So good morning, buongiorno. And thanks, Zoritza,
Buongiorno.
Liana, Evelina. It's a pleasure to be with you all today and share our experience. The purpose of my talk is essentially to give you a feeling of what we have tried to do over the last 2 decades, and maybe some of what we are going to describe could be of inspiration for some of you, because of course the challenge of integrating nurturing care and ECD into primary health care is a common challenge, and we are all faced with some obstacles that are probably quite common. I don't think I have to spend more words on these, let's say, principles that have been already well mentioned by both Evelina and Liana. I would like only to tell you that in the Italian health system, there is this professional called family pediatrician. It's a primary care professional. Children from 0 to 14 are under his or her responsibility. They, of course, take care of all kinds of diseases that may present from birth to adolescence. And one specific part of their work is to deliver the so-called well-child visits. There are either 7 or 8, depending on the regions, because the Italian health system is regionalized and there are some differences across regions. Of course, these well-child visits represent the best opportunity to deliver ECD messages to caregivers. I will try to give you a sense of the history about introducing these principles into the Italian health system, starting from 1999, when we started a program which is Nati per Leggere, which promotes shared reading in families with the collaboration of primary care pediatricians. And that can be considered, in fact, a forerunner program inspired by ECD, even before ECD was, ECD principles were disseminated and made, let's say, sort of a mainstream. Later on, in 2006, there was a similar program started, Nati per la Musica, which promotes shared sound experience within the family. And both, of course, are considered a mean to, let's say, promote quality interactions between caregivers and their children since the very first months and even before birth, because Nati per la Musica, in fact, promotes songs and music even during the last period of pregnancy. In 2001, we introduced a parenting program, which for the first time included an ECD component. And for this, it was called originally 6+1. Then it was called Genitori Più, which means Parent Plus. And this parenting program was initially a sort of a research project. So we, based on the positive result of the projects in terms of changing family practice, it became a national program introduced in most regions. This is an interesting part, could be inspiring for some of you, because we started to say that together with vaccines, breastfeeding, accident prevention, avoiding smoking, and so on, we need something else. And in this case, it was the shared reading experience. So it is. It was good to start saying that children need not only strictly medical advice, but also an advice in dimensions that are not considered traditionally as medical. So what happens after the first decade of this millennium? In 2011, ECD concepts were formally introduced in pediatric national congresses and training events. We published articles and so on. We had the first national seminar, which was a cross-sector event with economists talking, psychologists, educators, on investing in the first 1,000 days. And that was instrumental to have at Ministry of Health a working group established about the first 1,000 days, and this multidisciplinary working group at the end published document which was approved in 2019. And this is very important because, of course, it represents an official Ministry of Health recommendations and indications about what should be done at different levels within the health system and also beyond the health system, in collaboration with, for example, the educational system and the social system as well. As you know, the Nurturing Care Framework was launched in Geneva in May 2018, and we were very rapid to translate the document and present it to the Italian Parliament in October of the same year. That was also important because we did this with the collaboration of an NGO like Save the Children and other partners. So we really were instrumental in introducing and letting this, the contents of this very important document known throughout the country. Now, I think we have to mention that as a consequence of the Ministry of Health 1,000 Days document, now we have most regions introducing the ECD concepts and practice within their health prevention regional programs. And that is something which has just started, and we'll see what will be the effects of this effort. Just to give you an idea of the fact that the way we have ahead is still long, this is just a visual representation of the proportion of pediatricians that in fact promote Nati per Leggere. The program will be described by Laura later on, but just to give you an idea that the penetrance of this ECD-inspired program is still insufficient. We have big differences across the regions, and this shows that we have still a long way to go. At the same time, it is, I think, interesting to tell you that in an impact evaluation of the program, again, the program of promoting shared reading, we were able to establish that the impact of the program in terms of reading within the families and even avoiding any inappropriate use of digital devices, for example, was significantly better when the primary care pediatrician was involved. As you can see in the graphic, the red lines are always quite more significant in their result than the pink lines that represent where the program was established without the active involvement of pediatricians. we have also to mention stories that are not properly success stories. For example, I think most of you are familiar with this wonderful guide for monitoring child development, which in the hands of primary care pediatricians could make miracles, in our opinion, and not only in our opinion. We introduced this tool in Italy in 2018, first with the training of trainers. Then we started to train Italian pediatricians, but we have to stop because of the COVID epidemic that, hit Italy quite strongly. Another obstacle was the fact that introducing the use of the guide for pediatrician requires a course of 2 days. So we are faced here with both something that was not foreseen, like the epidemic, but also the fact that working with primary care pediatrician requires time, effort, and we have to find ways to make this easier. For example, now, together with Ilgi and others, we are looking at the ways of proposing this course in an online matter or hybrid, either hybrid or online methodology. On the other side, we are very happy that now most Italian regions have introduced nurturing care and 1,000 days concepts and practice into their prevention and promotion strategies. For example, promoting skin-to-skin and father's involvement in the maternities. For example, introducing in the immunization centers materials like books and toys and the presence of educators. For example, organizing prenatal sessions that talk with parents about the fact that they are becoming parents, and not just about the physiology and the pathology of the delivery. So we are now witnessing a very interesting increasing interest in these issues by other health professionals, for example, midwives and nurses. And so we are see that we can see that even in other aspects, other touch points of the health system, there can be ECD messages given by the midwives, the nurses, along all the itinerary from pregnancy to the first years. Looking back to what we achieved, I think that one of the main strengths was, in fact, having a leading organization like ours that kept introducing the principles, disseminating, working, organizing congresses, making advocacy with policymakers, organizing multi-professional training, which is very important because it puts together doctors, midwives, nurses, but also educators, librarians around the common purpose of introducing, for example, the shared reading into families. But also we were very lucky to have a very good partner in the Ministry of Health, and particularly in the Istituto Superiore di Sanità, which is National Institute of Health. They've also worked a lot, and they, of course, they led the development of the 1,000 days document. They've started 5 years ago a monitoring system looking at how in different regions, health systems, the different ECD practices were introduced, for example, reading and others. So we have a national commitment to see to which extent these practices are being introduced. On the other side, I think the main weakness and the main weakness is still the lack of pre-service training for health professionals, where ECD principles are still quite marginalized, I would say. And I think this is a Europe-wide and probably also in Central Asia problem that we have to address. In general, we are also seeing a lack of investment in health promotion and prevention, and that's the problem of many health systems. And this is also a common issue, I think, across Europe and the whole region. And finally, a problem is the fact that different services, for example, the education, the health sector, don't talk to each other enough, and they should do, because we have this idea of the holistic development of the child, that is a whole child that cannot be separated. So all these messages about education, development, early development must be shared by all the professionals working different services, and that we should have common plans to invest in this matter. So the challenge is, I see that the system approach, where we go municipality by municipality to try to have mechanism that put the different sectors together around the table to discuss how they can collaborate to accompany families and to show families and caregivers what they can do best in growing their children. Another challenge is pre-service training, and we are trying now to address the universities to possibly introduce ECD and nurturing care in pre-service training. And then, of course, another challenge is multi-professional training, which I mentioned, because multi-professional training, and I remember we did a seminar for ESA a couple of years ago. It's a crucial aspect, you know, because putting a different professional around the table to share, for example, a training ECD principle makes these professionals able to talk the same language, to speak and give the same messages to families to understand how they can work together. The opportunities which I mentioned already are the introduction of these issues in regional health prevention plans. We have built, as a matter of fact, we are starting to use this nurturing care training module, which we built together with the National Institute of Health. So now it is proposed to university, but also for in-service training. We have a child guarantee plan, which is a European community initiative, and which is aimed to cover the needs of the less privileged, the most disadvantaged children. And then now we have just started a very interesting EU project on fathers' engagement, nurturing care, which builds on the evidence that children that have their fathers engaged in care and education since the very first days are children that have better outcomes also in adolescence. So just to give you an idea, just tomorrow I'm going to give a workshop for primary care pediatricians, and I will follow this outline. I hope it helps some of you. We will start to show the evidence about the factors that contribute to determine early child development, and to show how the home environment is very important. Then we will show that promoting responsive caregiving, working with parents, is possible. We go through the different intervention trials and studies that have been done on this subject. And then we show how the primary care pediatrician, what they can do in their daily work with families to promote responsive caregiving, going even beyond the shared reading experience, which is common for some of them. And then how to set up a system approach with the other services involved. So I think we have to go through this kind of trainings and of opportunities where we share with our colleagues, not only pediatricians, but also other health professionals, the principles and the importance today that we are witnessing a dramatic increase in the mental health problems and neurodevelopmental problems and behavioral problems and social problems. We have to understand that the roots are here. We can do a lot in order to change these trajectories. Just to show possibly inspirational last image you see here, that you can leave your footsteps and somebody can be ready to pick them up if you're good enough. So with this, let's say, hopeful message I leave you, and I wish you good luck in your work.
Thank you, Giorgio, so much. You showed us how you walked the long road and how you won, in a way, you won a battle that was worth fighting for. The battle is not finished, but you managed to create, not you personally, but your team and people around you, you managed to create this such an important space for dialogue between different sectors and different professionals. And also, what is very important that people understand is that you have to address the whole system. You cannot stay on the level of professionals. If they are not supported, nothing will really change. So thank you for highlighting this very important moments. And now we are going to see how these beautiful ideas look in the practice. So let's move to the field, and let's start with the national program Villaggio per Crescere, the village that grow. These are the villages in Italy where parents and children up to 6 years of age engage in meaningful activities and learn by doing. Aduena is with us. Aduena, welcome and thank you for joining us. You are the program manager of this project, and we would like to hear from you about your work and the impact it has on children, families, and communities. So the floor is yours.
Thank you very much, Zorica. Good morning and good afternoon, everyone. So I will just share my presentation.
I hope you will start with video.
Yes.
That you promised us.
Yes.
I'm very excited to see it.
I wanted to introduce this wonderful program by sharing a brief video with you so that you can have a closer look on what we do in our daily activities. And then I will go a little bit more into detail. So.
Lassù, su nella sua cameretta, Roberto sente una cosa terribile che sale. Si infiamma feroce come il fuoco, che divampa e non si riesce a spegnere. Tutto rosso, giusto?
Ok, Okay, so what do we have here? What did you see? This is what happens in the village. So we have a space where parents and children are together. Now, in this case, we have a person who is reading a book. She's an educator, a professional educator, and she's reading a book and interacting. Children are interacting with her and parents are listening. And so they are living this moment together. Now, why did we create such a space where all of these people are put together? So parents, children, and professional educators. Because through this countrywide project, which is Un Villaggio per Crescere, a village to grow together, we aim to strengthen parental responsiveness. How do we do it? Through this very practical and participative approach, and in economically, socially, and culturally disadvantaged communities. Here on the right of my screen, you can see the geographical extension of the project. And through this project, we offer parents and children the opportunity to spend quality time together. So the core of the project is the joint participation of parents and children together. The target is children aged 0 to 6 with a specific focus on the 0 to 3. The project is free. Parents can attend for free, and centers are opened for 4 to 5 days per week for about 12 hours. And what we do is we have educators facilitating activities, and the activities that are proposed, you can see some real pictures here on the right, are evidence-based activities. So shared reading, experiencing music together, playing with simple objects. We call it playing with nothing, that is to say, with very homemade materials that you can also find at home. The final aim is that then parents incorporate these activities into their routine at home, so that we have this change of attitude and of practice, and we strengthen their knowledge, and therefore we work on parental responsiveness and also child development. We know very well how these activities that are very simple, how powerful they can be for both parents and children. We do not work just on our own, but as Giorgio was mentioning before, we know that working together with other services is very powerful, so that parents and their children are accompanied from the very beginning, so from pregnancy on into the first years of life of children. So we engage, we connect with different services, the health sector, the educational sector, the social sector. And also we try to engage other community actors that may seem not directly involved with taking care, let's say, of parents and children, but that they are part of the community. The idea is to create a learning community where all the different actors are involved. So public services, commercial services, non-profit, religious services, etc. Because we are talking about the well-being of the community, not just about the well-being of parents and children that attend these centers. I don't have much time to go into all the details of the project, but you can find some more information in this article issued in 2020 by Early Childhood Matters. So I hope you have the time to read it and yes, to find some more details about the project. Now, talking about the connection with the different sector, and specifically the connection and the collaboration with the health sector, I will give you a short view on what we do in practice. So we can say that among all the village centers that we have from the north to the south of Italy and the health sector, there is a mutual collaboration. There is a bi-directional collaboration. The project is active since 2018, and in all of these years, we have engaged with different structures. So local healthcare structures, local hospitals, specifically with the maternity and the pediatric ward, and local family counseling services, engaging a variety of health professionals, such as family pediatricians, midwives, speech therapists, physiotherapists, psychologists, and also neonatologists. Actually, I didn't include it here. How do we engage them, and what do we do in practice? So after getting in contact with these health professionals, and after presenting the project and its objectives and what are our final aims, health professionals advise their families with both typical and atypical development to go to the village, and vice versa. That is to say that parents that attend villages and parents and children that attend villages are sent to health professionals. That is to say that educators of villages facilitate the contacts that families have with health services. You know, we have nowadays all kind of information, but families get lost in the system. They don't always know who to refer to for this specific issue, where to find the right information, where to go. So it is very important the role that educators have in this facilitation of contacts. This happens all the time, but especially when there is a specific concern of the family that has to be addressed. Then educators of the villages take part in antenatal and postnatal courses that are organized in Italy by family counseling services. They present the project to parents-to-be new parents and invite them to attend the village. We saw that this is very useful because especially in the first years of life, especially in the first year of life of children, parents tell us that they feel very alone and very isolated, and the fact that they are engaged since the very beginning help them because they can share their concerns, their doubts with other parents that are living the same things, that have the same questions, you know, so that they can rely on each other and also on professionals such as educators. So this has been very, very useful. Then educators are also available for home visits. For example, in the case of children affected by serious chronic diseases that, of course, due to their situation, they cannot attend normally the village. So the educators are precisely available for home visits. Then we also organize webinars for village parents on specific topics that needs to be addressed and that are raised by parents themselves. And we engage health professionals for doing this, like, for example, midwives or family pediatricians, etc. And also this is very useful. And then with all of the health professionals that we engage, we also share written and visual materials because, you know, also the setting is important, and parents that visit these centers are somehow you know, encouraged by the materials that they see, by the posters, you know, and so it is also important to have this kind of materials. Before finishing, I just wanted to share with you two, let's say, success stories, two recent stories that we had, just to get a little bit closer on what happens usually. So we had we have in one of the villages this mom. She's a single mom. The father didn't acknowledge the son. She's unemployed and homeless. Now she's living at her cousins, but she doesn't have a home of her own. She was accompanied at the village for the first time by a midwife. She was completely alone. She was in need also for clothes for her child. In the village, we also have, besides of the activities that we propose, we also have this habit of exchanging clothes. So parents that have clothes that they don't use anymore because doesn't fit anymore for their children, they bring them to the village and take what they need. So this is also useful from an environmental point of view. So this mother, after giving birth, she returned to the village with her child, and she's been attending for a month now, and she has made new friends. She also meets with a mom that she knew at the village, also outside of the village environment, and she is very friendly to everyone, and she frequently asks for advice on the development of her baby, what to do, where to go, how to get in contact with this service, etc. And now she can rely on her peers, so on other mothers and fathers as well, and also on educators. And then we also had this other family, which was sent to who was sent to the village by a pediatrician. It is an Ukrainian family that have a 2-year-old child with a suspect of ASD. So when the child arrived at the village, he didn't make any sound and he didn't had any contact with his peers or with adults. So it was very difficult. And now after 4 months, he vocalizes a lot. And he listens when an adult speaks to him. He still has some difficulties in interacting with his peers, with other children, but we can see that we have an improvement here. And this is very important, not only for, for educators. The educator who told me this story told me that she was about to cry when he saw how he improved, but also for parents that can actually see that things can work. So this is just a quick view on what our daily work is, and you can see from this few information how powerful the connection with the other services is, because families feel that they belong to a working system where they are not alone and where they can rely on different actors. And this is very important. So thank you very much for listening.
Thank you, Anduena, so much for sharing. And it's very interesting to listen. First, to be aware that this kind of approach was established by an NGO focusing on the health of children and families, which is not very common. We would expect that education system is doing that, but health system is taking a lead, and I think that what you did is like showcasing how to build this kind of network of support, like creating a space where people feel comfortable, protected, and have access to different sectors, and above all, and the most important, creating opportunities for people to work together and to see health sector as one of the sectors, not the most important and the only one. I think it's also changing the perspective on health. So thank you so much, and you can connect with International Child Development Initiatives, because they're doing some kind of play hubs around different countries where they're trying to bring together different sectors together. Thank you so much. It was inspiring, and I see some comments here that in other countries people are trying to do similar things. But now let's go to Nati per leggere, Born to Read. This is a national program which promotes reading among families with young children, but reading in pediatrician institutions, which is not a very common place to read the picture books. So Laura, you are the primary care pediatrician from Associazione Culturale Pediatri from Italy, and you are also a president-elect of European Confederation of Primary Care Pediatricians. And we believe that this is very encouraging, that pediatricians are seeing that they have to do more, that there is the health is more than healthy body, that we need to invest more. And this is also, you're also a passionate advocate for this kind of program. And you are, as much as I could learn, you are a passionate advocate to bring joy and build meaningful connections between pediatricians, families, and children, so that they can all thrive. So please tell us something about Born to Read.
Okay, thank you, Zorica. I'm trying to share my screen. I hope you see it. Okay.
We see.
Okay, and do you hear me well, please?
Yes. See you, hear you. Everything
Fantastic.
is working.
Fantastic. Thank you for your kind presentation, and thank you to you and to the all organizers for inviting me to this wonderful meeting. Yes, I'm here to speak with you about promoting shared reading in the pediatric clinic, the Nati per Leggere program in Italy. I can begin from this point. Early child development and nurturing care for early child development are the reference standard for every policy and program that deals with childhood. I think that there is a good agreement about this point. This program is finalized to protect and promote the development of the child in its different dimensions. A child is not only a height or length problem or acute sickness problem. Well, that is what exactly primary care pediatricians should do in their clinics, and mostly during their well-child visits. What well-child visits are? They are routine pediatric visits at appropriate ages for comprehensive preventive health services that are essential to tracking growth and developmental milestones, discussing any concerns about the child's health, getting schedules, vaccinations and screening tests, and evaluating and promoting neurodevelopmental health. Talking with parents about child and family wellness, not acute and banal sickness visit or clinical visit, but in a gentle and calm atmosphere to speak all together with the families about how the situation is going on, how the child is growing. It's a pleasant and important moment. In this child visit tools, we have some tools, and one of the most important tools are simply the books. Nati per Leggere, Born to Read, is used in Italy for this purpose. It started in 1999 and is a national program that promotes shared reading in family from the first years of life, from 0 to 6 precisely. And Nati per Leggere is an alliance made by Associazione Culturale Pediatri, that is an Italian pediatric association of about 1,500 Italian pediatricians, that has a scientific journal like Quaderni ACP, and it deals with clinical and social pediatrics, participates in national working groups, implements projects, including for health promotions. Other partner is Associazione Italiana Biblioteche, that is the association of more than 4,000 librarians and promotes the organization and development of public libraries in Italy, and is a fundamental institution for the development of effective policies for reading. And lastly, but not least, Centro per la Salute del Bambino, that is a non-profit organization engaged in training, research, and program, as we have just seen and listened. CSB collaborates with WHO, with UNICEF, and numerous other entities and organizations. And this good alliance is important, you know, is a trans-professional alliance, a very new concept in primary care setting. And the key concept of this program are early intervention since the first months, the central role of the family environment, and a universal coverage. You know, they are the same basic concept of the early child development. Well, the program Nati per Leggere is a community intervention that conveys a simple, concise, intuitive message. Reading aloud from the first months of life is a beautiful thing to do together. And we have to remind to the family this point. It's useful, it's possible for all parents and able to produce important results in relationship between parents and children, and in the future speech abilities and school performance of the child, and more. If at the beginning Nati per Leggere was promoted mostly for reading aloud to children and stop, over the time this definition has changed to shared reading in the family with children from the very first years of life to promote relationship. Now the program is realized not only throughout the commitment of pediatricians, but as you have just heard, with midwives, nurses, librarians, educators, reading volunteers, and other professionals involved, all the professionals involved, we would like to say, involved in child services in our country. Why the family pediatrician, the primary care pediatrician, has a strategic and positive role? Well, because he or she has early contacts with families since birth, because visits regularly all children from the poorest to the richest with no payment, is influential and provides anticipatory guidance on child development. Well, this means that pediatricians can reach all family and can work in a network. For example, I do something like this. I read book with the children in the neighborhood library of my city, and with the local family counseling service of my neighbor. It's pleasant because children see me in different settings, but do the same things. And parents look at me doing this, and so they are learning by doing. They do the same at home. And this is a very nice and pleasant situation. The most important thing is that we could reach all families, even though it's not so pleasantly done in all Italy, as Giorgio showed before. Anyway, Nati per Leggere changing the perspective of the pediatrician's daily and clinic practice, because we can do parenting support in this way, and we can make capacity and trust from before birth. And from the first well-child visit, the pediatrician focuses the parent's attention on the power of a mother's voice, the awareness of waking states to catch moments of attention. Look at this, look at the child who is following the figures on the book. Look, can the pediatrician tell to the mother? And the pediatrician can point the attention to the best practices, singing, voices, voicing, touching, and so on, hugging, reading, can point the attention to the importance of responsive interactions. Otherwise, training for pediatricians focuses on the importance of being able to communicate with parents with a change in paradigm, the importance of a good communication, open questions, active listening. And this is important from the birth, to have a good relationship in the family and with the pediatrician too. This could happen better in an environment oriented toward reading promotion in family, a pleasant and calm and gently like this. And so what a primary pediatrician can do? He can make strategic for early and regular contact and universality of intervention. He can make well-child visits and anticipatory guides. He can show the book for assessing the parent-child relationship and look at the book and the parents in a developmental assessment modality. I mean, look at the fine motor development, look at the cognitive ability, at the expressive and receptive language. And you can obtain this in a very simple way. You can setting up a small reading point in the outpatient clinic involves little space and resource, so you can do it simply, because walls speak before we do. Lastly, there are recent developments in Nati per Leggere program that are very interesting, involving fathers. There are not only mother. Papà mi leggi is the Italian way. It means, Dad, please read me. Specific health setting and children with special needs, like pediatric oncology departments and so on, as you have seen, La lettura che cura, migrant families involving the whole community. All these programs are the natural dissemination of the ability to reading a book together. And they are very important because from the hospital to the pediatric setting, you can find the same thing. There is a line, you know, it's a relationship. Conclusions, I would say no. This is a great work in progress. Thank you for your attention.
A little bit confusing. No, still no conclusions. We are still work in progress. Thank you, but it's really magical what one book and a little bit of thinking and reflecting can create the magic. We always think we need something very complicated, and I saw some videos and I had the opportunity to talk with Giorgio before. There is a lot of joy on both sides. Yeah. Everybody is joyful. Okay, thank you so much. So let's see, do we have any questions from the audience? Because I'm also looking at the time. I don't want to go too much over time. So I would like to ask my colleagues Alexandra and Vera. They were observing the question and answer box. Do we have questions for our presenters?
Thank you, Zorita. If I can say, there are, in the question and answer box, there are quite a lot of questions, which is really nice to see. But for the sake of time, I would like to pick one, which I think is maybe a question that many of us who try to promote and strengthen counseling related to ECD ask themselves. It is a question to Dr. Riali from Armenia. How many minutes is allocated for well-child visit to primary health care? Because in Armenia, most of the primary health care providers are in a hurry and can allocate allocate not more than 15 minutes. Usually they skip many things related to child development, nurturing care, and just go with the main medical issues that they monitor. So this is one question, because I think it's really something that we often face, and there is one more question, is more related to the evaluation, monitoring and evaluation efforts of the program. And could you provide a little bit more details about the impact of the impact evaluation process, and how data is collected, and is it interest looking at child outcomes in terms of early literacy or long-term effects, for example?
But I think that, sorry, Vera, for intervening. I think that this question about monitoring and evaluation and impact can go to everybody, to Giorgio and to...
I can answer best to the first question, because it's my job, and the well child visit in my practice, it's almost 30 minutes, sometimes 1 hour. It depends for the different ages of my patients and for the different situation. But the most important thing is that in our practice, we can have a lucky opportunity. We can repeat the situation. If there is no time, if there is a problem that you don't have the time, okay, you can return tomorrow within 2 days and we can go on. And as I can say, if you do it fluently and calmly, the time is growing, as I can say in English. The minutes are different if you are in rush or if you are calm in your mind. So it's important to find the right way, the right situation. The child must be in good condition, the mother too. And if there is no situation, you can say, okay, this is the first appointment. There will be another possibility when you want. And you repeat it. At the end, it works. But of course, the different situation and the different organization of the service can request some flexibility. And it's difficult to explain in different nationalities how you can do it. Flexibility could be a good word to use in this situation.
Find a way to adapt and
always
find a way to
always pediatricians
to play
do
the
it.
systems. Yeah, but I think it's very important that I think that Giorgio started his presentation with these results, like, which means that you are doing monitoring and evaluation of the program, and that the results were, sorry.
Sorry, I didn't want to interrupt you. Please.
No, please interrupt. I'm just worried about time. I don't want anybody to complain that we went too much over time.
Shall we try to provide an answer to this?
Yes, please.
Yes,
Giorgio.
yes, please. This was Giorgio, please answer to the monitoring.
So we have, in terms of monitoring of nati per leggere, we have a biannual monitoring system that's telling us the quantitative aspects of the coverage and how many professionals involved, how many daycare, kindergartens involved, and so on, which I've shown you just one of the maps of that pediatrician. In terms of impact evaluation, we have, of course, we need a much more complex design. Recently, we've had an impact evaluation done with the help of economists in the Piedmont region, and they were able to link longitudinally the participation to nati per leggere with the Invalsi PISA results at the 4th year of the primary school, showing that children that were involved in the program are having better results in both literacy and mathematics. But the most interesting thing is that the most significant results were achieved in those children that belong to disadvantaged, low
group.
income, low education, which is a result that we see in other programs throughout the world. I mean, the benefits is greater for those that otherwise wouldn't have had this opportunity. In terms of the village, you have a complex design, which includes the impact on caregivers in terms of parental stress, parental responsiveness, with a let's say a battery of different tests and questionnaires. Then we have a distance evaluation of the competencies of children after 2 years from the intervention, after 2 years from when they participated to the village. We are doing this through a tool, which is the IDELA tool, developed by Save the Children, which we have used already in our country. So we will be able to see whether there are differences between children that have participated and children that have not participated. And then we are also trying to evaluate the impact on educators in terms of quality of their interaction with parents. This is just
this is very brief,
an idea,
but
of course we have to try to have an impact evaluation in order to show that also, vis-a-vis the funders.
Yeah, but I think it's not only about the funders, it's also the brains of medical workers. You need some proof, some statistics, some data showing that this work is. Now I'm very biased, but this comes from my family background.
So
doctors love to know that this.
It would be good if professionals would just be changing their practice by scientific evidence. Unfortunately, this is not enough scientific evidence. They have to have some, let's say, sometimes economic incentives, and most important, they have to understand that their professional contents are enriched by this.
Yeah.
And the perspective of these professions, these health professions, is exactly taking care of these aspects. Because what everybody is witnessing now in the health indicators is that mental health is the problem.
Yes.
Behaviors are the problem. Social issues are the problem. And the roots of all this is in the hands of primary care professionals, of course, educators, families, etc. So once you understand that, you understand that you are at the
very powerful. That you as professional has power and your system is very powerful. And I hope that you will be open, because there is a lot of questions now popping in, and we don't have time, that you will provide some contact and that people can contact you as our member directly, and who knows, learn more from you, and maybe you can do something together. Thank you so much. It was, for me, it was a huge pleasure. Pity that it's short. It would be nice to have more time, but as Laura said, we don't have to do everything in one meeting. I would like now to invite my colleague Alexandra Jovic from UNICEF ECHARO to make some remarks, share some interesting information, some nice things that are going to happen. And I hope that you are all inspired by this meeting. Me personally, I am, and extremely grateful for our colleagues from Italy. So, Alexandra, the floor is yours.
Thanks a lot. With a huge thanks to the presenters that, as you said, have been really inspiring, but also to all the colleagues who have stayed until the end and really engaged with a lot of interest. And I got a task to summarize in 5 minutes the key takeaways. And for me, there have been many, judging to on your questions and comments as well for you. But I would like us to recall that the story or success story of Italy started 20 years ago with a lot of commitment and the drive that was led by the NGO, but maintaining the high level of awareness and keeping the ECD high on the agenda. You will recall that they presented the nurturing care framework, only a few months after it was introduced globally in the Parliament of Italy, pitching for the highest level of the government, or not on the government, but of the country. And then, getting a Ministry of Health, National Institute of Health on board to develop 1,000 days document with recommendations and to start monitoring how are these practices implemented. So they had the highest level of also support and accountability and the commitment of the government to support the process that they were able to sustain because they continuously demonstrated and measured evidence from the program implementation. As Giorgio mentioned, there are still a number of challenges, and we hope to continue discussing them in the forthcoming webinars, starting with the lack of the pre-service trainings on ECD among health professionals, lack of investment in health promotion and prevention, and the lack of intersectoral collaboration. If we want to provide holistic support to children, young children and families, it has to come from all the different sectors and all other actors in the community that, again, example of Italy so beautifully demonstrated through community services, through the alliances of different professionals at the national level. And I think that you mentioned transnational, or, even a new—
This is another webinar, trans-professional collaboration. Yes. We have to work on that.
I think that what was also important is that Giorgio mentioned the number of opportunities that Italy has, and that is the available nurturing care training that they are delivering to all the health professionals, but also professionals coming from other sectors, continuous demonstration of the evidence and impact, the integration of these programs into the Child Guarantee Plan, what is for all EU member states, the new source of funding, but also opening for Western Balkan countries as an opportunity, and further developing now in the areas of fathers' engagement. For all the health workers, pediatricians, I think that my question that we didn't have time to address was if the 1,000 days program introduce also different kind of space for pediatricians to have half an hour for the well baby checkups, as colleagues are raising that this is the main problem that we have across the region. But also what Italy demonstrates nicely is that a health system or any single system cannot address everything alone. So referral and linkages with the community-based services, such as a Village to Grow Together, are necessary to provide additional level of support to parents among different professionals who speak the same language. And finally, I think that the Nati per Leggere is a beautiful example that maximizes the value of well child visits, in which pediatricians can demonstrate and model behavior and responsiveness through very practical examples. And I really believe that the time allocated for it also mirrors the importance of it, because if you spend 1 minute to say, and child development is important, so talk to your child, it will also be understood as a parent as something, well, if there is time and if there is space, we can come back to that. But most of all, I think that the note of all the presenters was what also Giorgio shared: keep trying, because someone else will pick your footsteps and continue. And I hope that this will be inspiring and kind of leading principle for all other countries and colleagues on the call. Thank you for that attention. And just a few more remarks. The Health Systems for ECD initiative is yours initiative. It is not our initiative. And we hope that you are continuously visiting it and using all the resources that are available there, and that we will keep expanding and informing you through the newsletter that will be issued monthly, if not bi-monthly, with all the information on what are the new resources on the Knowledge Hub, what are the key takeaways from the webinars, what are some of the initiatives that might be interesting for all of you. So please subscribe to the mailing list. There are codes in the presentation, and all the materials will be shared with you after the meeting, recording of the webinar, and all again links so that you can subscribe. That is the only way for us to reach you. Please also be free to share this information with your colleagues, other professionals, so that we can expand this learning community with them. And on the next slide, you will see that we are planning a lot of interesting events in the near future, with 2 webinars planned until mid-April. The first one will be in collaboration with the WHO and the presentation of their pocketbook for primary health care, with the focus on developmental difficulties and identification at the primary healthcare level. And the second webinar, that will be the regional launch of the Nurturing Care Practice Guide, developed again jointly by WHO and UNICEF, again with very practical tips and discussions on how can it help us actually streamline and support early childhood development within the primary healthcare. Please block your calendars, and we are looking forward to see you and engage with you again. Million thanks to all the presenters from Italy, to facilitators and to translators that have enabled really, I think, smoother follow-up of many colleagues from the whole region.
And thank you, Alex, for this beautiful wrap-up. And goodbye, everybody. Thank you, and hope to see you soon. Bye.
Ciao.
Thank you very much.
Oh, ciao. Mille grazie. Mille grazie.
Perfect Italian.